Hi, my dear follower. Today we will talk about the indication of human fetal stem cell and other clinical benefits in human fetal stem cell therapies. I will continue to say the indication of human fetal stem cells. The first one is, as you know, autism treatment. Autism is an indication of human fetal stem cells, my dear follower. And the success rate is very high in autism therapy, as you know. Autism, there are 4 disorders that fall under the heading of autism spectrum disease. The first one is autism, also referred to as classical autism. As you know, Asperger's syndrome is the other one. And childhood disintegrative disorder, CDD, and pervasive developmental disorder, PDD. That is totally 4-1. Stem cell therapy is a novel and effective approach to the treatment of autism spectrum disease based on the unique ability of stem cells to influence metabolism and immune system and to restore damaged cells and tissues. If you have any question, please write on comment part. I will answer then. You can ask everything you think you can ask, and I will answer to after my chat. Now I am talking about the autism therapy with human fetal stem cell. The fetal stem cells, FSCS, used by our clinic have a positive impact on all of the body's organs and the systems, but starting with the brain. This is extremely important because with autism spectrum disease, the brain areas regulating memory, concentration, and other attention, speech, and so are damaged. Our treatment results is in better blood and oxygen flow to the brain. That is called improved perfusion. Better replacement of damaged neurons and better formation of new arteries. After a certain period, fetal stem cells acquire the properties of surrounding cells and differentiate into them. This leads to the restoration of white and gray matter and consequently to the subsiding neurological symptoms, ameliorating neurological symptoms and improved intellectual capacity in the children. As impaired or lost neuron connection are restored, and new neurons connection from and brain reaction accelerate because synaptic transmission improves. Improvements in autistic children that can be expected after stem cell therapies. I will talk about this topic, improvement in autistic children that can be expected after stem cell therapies. First one, better tolerance for different foods and improved digestion. Some children begin to try new foods and like them. The second is the contact with child, starting with eye contact. And children who did not fix their gaze at objects, looking at them with interest. That's very important for an autistic child. More adequate behavior at home and outside. Reduce or loss of fear and loud noises, strangers, and bright colors. This improvement is gradually. Improved verbal skills is very important in childhood period. If the child was not verbal, it is very likely to start making sounds. It's very likely to start making sounds, produce syllables, and eventually pronounce words. Verbal children are likely to expand their vocabulary capacity. And other second part of treatment of this human fetal stem cell in autistic child, development or improvement of writing capacity. That is very important. and improve self-care skills. Improve self-care skills. More sustained attention span and concentration. Although the degree of the improvements varies from child to child, they have been reported in all cases. One of the main goals of stem cell therapy is triggering brain development and preparing children for adult life by developing the skills they will need the most: communications, self-care, and learning and professional skills. I'm talking about the treatment and efficacy of stem cell therapies in childhood autism spectrum disease. My dear follower, if you have any question, please write comment part of social media, and then I will answer all of your question. I want to continue to my chat about autism spectrum disease and human fetal stem cells. Stem cell therapy is an effective cell therapy and safe method for treating autism that can help your children with autism and with autism spectrum disease or of different degrees. The earlier treatment is started, the better the results that you can expect. Stem cell is a very powerful engine. In autism spectrum disease. But the best results are reported in combination with proper prenatal care, diet, educational programs, and other methods. Yes, my dear followers, we advise stem cell therapies, especially human fetal stem cell and human embryonic stem cells treatment in autistic spectrum disease. Please, if you have any question or advice on this topic in autism spectrum disease, please write there. I will reply then. That is the first indication of human fetal stem cells, which is autism and autism spectrum disease. And other indication of stem cells is anti-aging processes. Anti-aging treatment we can make in Ukraine, Kiev. This treatment, not in Turkey, Istanbul. We are doing anti-aging treatment with human fetal stem cell in Kiev, Ukraine. I'll talk about some anti-aging treatment as we age, self-renewing capacities of the body naturally decline. This is because stem cell resource of our body gradually deplete, and the ability of stem cells and multiply and replacing cells with new ones diminishes. Stressful life, malnutrition, bad habits, and poor environment accelerate this process or body decline. Is there any chance to revert or at last slow down this process? Yes. We can slow this process with human fetal stem cell or human embryonic stem cells. We offer a novel anti-aging therapy using a natural and holistic approach. Our fetal stem cell programs are aimed at both the prevention of premature aging and age-related disease and the maintenance of youthfulness. I advise anti-aging study in Ukraine with human fetal stem cell. If you anyone who wants to make this process, we can help him or her. Please contact with WhatsApp. Other indication of our human fetal stem cell therapy is heart treatment. As you know, there are a lot of heart disease, like congestive heart failure and arrhythmias and acute myocardial infarction and other like cardiomyopathy or dilated cardiomyopathy. There are a lot of indications in heart treatment concept. Application of fetal stem cell suspension in rehabilitation period in post-infection cardiosclerosis and hypertension patients has positive effects on overall health as well as on rheological properties of the blood. These effects have been proved by clinical data of post-infection and ischemic heart disease patients followed at our clinic. When using fetal cell suspension containing stem cell, syndrome of early post-treatment improvements in some patients is observed. Not in some patients. The early post-treatment improvement is observed in all patients. The major manifestation of this syndrome include decreased weakness and improved overall health and appetite, normalized sleep formula, positive change in post-physical emotional share, and such as reduced manifestation of stomachic depression, like this. Heart treatment. In heart treatment, the therapeutic effects of human fetal stem cell is very well, and clinical success rate is very high, especially in heart failure and dilated cardiomyopathy and arrhythmias and post-infection rehabilitation of heart. That is third complication. We talked about the heart disease. Now, other indication of human fetal stem cell is diabetes treatment. As you know, diabetes is a very complex disease and frequency is very high in the world. We estimate 11 million diabetes patients in Turkey, as you know. Our clinic, a new advanced patent method for diabetes medicine that has been proved effective in treating type 1 and type 2 diabetes medicine and in preventing diabetes-related complications which usually affect the eyes, arteries, kidneys, and so on. In combination with traditional treatment, diabetes type 1 fetal stem cell helps the patient and the autoaggression of cell-mediated immunity factors against B cell, prevent the destruction of B cells that are functional at the time of the treatment, restore the patient's own beta cells and improve their functional capacity, and prevent diabetes-related complications affecting eyes, kidneys, peripheral nerves, and so on, improving independent tissue conditions. In type 2 diabetes mellitus, the fetal stem cell can help restore peripheral tissue sensitivity to insulin and reduce atherogenic hyperinsulinemia and decrease the production of glucose and the pathologic lipids by liver cell, improve the condition of arterial walls, and which is vital for the prevention of atherosclerosis and complications arising from it. Reduce the dose of hypoglycemic medications. Within 24 years, attention please, 24 years, within 24 years, our clinic has treated hundreds of patients with both diabetes 1 and diabetes 2, with improvements reported in 65% and 74% of cases correspondingly, such as stabilized carbohydrate metabolism resulting in more stable blood sugar levels and a gradual decrease of hemoglobin A1C, normalized blood counts, and longer periods of remission, and reduced severity and frequency of diabetes-related complications, higher exercise power, improved sexual capacity, boosted immunity, and better overall life quality. If recommendations are followed by the patient's lifestyle is healthy, a gradual decrease in hypoglycemic medication dose is also possible. Diabetes treatment for children, I will talk this topic later. For children, especially the children have type 1 diabetes mellitus, as you know. It is very important in our country, Turkey, so we have a lot of diabetes type 1 disease patients in Turkey, we estimate 1 million patients with diabetes 1 in Turkey, especially. The frequency is very high in Istanbul and in Trakya region. Other indication of human fetal stem cell, my dear follower, is multiple sclerosis. Multiple sclerosis treatment with human fetal stem cell we are managing in Ukraine, Kiev. Cell Therapy Center offers multiple sclerosis treatment using fetal stem cell with improvements of reporting in most cases. The goal of MS treatment, multiple sclerosis treatment, is to terminate autoimmune aggression. That is the internal attack against patient's own nervous system. By restricting the main mechanism of the disease, this is leads to the subsiding or even regression of neurological symptoms. With MS, fetal stem cells have two major functions. One, prevention of nerve cell damage. Stem cells are able to help reduce or even prevent damage caused to nerve cells. As you know, this process is called neuroprotection, and other is repair of damaged myelin. In multiple sclerosis, the protective myelin layer surrounding nerve fibers is damaged by the person's own immune system. Specialized stem cells in the brain can generate myelin-producing cells, which facilitate the repair of myelin, and this process is known as remyelinization. Yes. If you have any question of human fetal stem cell treatment, please write there. I will answer later. Within 25 years, our clinic has treated hundreds of patients with different forms of multiple sclerosis and achieved improvements in 85% of cases. Attention, my dear follower. Improvements in MS with human fetal stem cell is 85% of cases. That is the fourth indication of human fetal stem cell. As you know, multiple sclerosis frequency is rising around the world, especially in Turkey, in Istanbul. We have a lot of multiple sclerosis patients. They need human fetal stem cell treatment. The treatment is not in Turkey. We managing the treatment is in Ukraine, Kiev. And other indication of human fetal stem cell is muscular dystrophy treatment and other dystrophin disease. Muscular dystrophy treatment cell therapy we can treat with this disease, human fetal stem cell. For different types of muscular dystrophy, we know fetal stem cell has proved to be one of the options leading to not only the reduced muscle wasting, but even to some regression in the main symptoms of the disease. In the course of MD, muscular dystrophy, with stem cells, pools of genetically healthy cells are created in the patient's body. These cells pools are capable of producing dystrophin, which can penetrate affected cells. There are two positive clinical effects human fetal stem cell on muscular dystrophy treatment. One is production of healthy muscle fibers. Stem cells without the genetic defect that cause muscular dystrophy can be delivered to a patient's muscles, where they generate working muscle fibers to replace damaged ones. And other benefits of it is reduced inflammation. In muscular dystrophy, damaged muscle become quite inflamed, and this inflammation speeds up muscle degeneration, and stem cell release chemicals that reduce the inflammation, slowing the progress of the disease. My dear follower, muscular dystrophy, especially Duchenne muscular dystrophy, is the other part of indication of human fetal stem cell. There is no treatment in Turkey with the God cell. We are managing treatment this process in Kiev, Ukraine, under the license of Ukrainian Health Ministry. Other indication of human fetal stem cell is ALC-MND. ALC and MND disease. It's very important, and that is fatal for human beings, and it's very big problem in the world. Especially amyotrophic lateral sclerosis is a big problem. Amyotrophic lateral sclerosis, other name is Charcot disease, or English-speaking countries saying Lou Gehrig's disease, as you know, or motor neuron disease is a progressing illness that manifests as gradually weakening and atrophy of muscles and lasts for 2 to 5 years. Major manifestation of amyotrophic lateral sclerosis, I will continue. One, weakness, or muscle spasm and disorders of speech, and pathological reflexes, fibrillation, atrophy. Like this, there are a lot of manifestations of this disease. Amyotrophic lateral sclerosis is a poor prognosis disease. My dear follower, treatment of ALC with stem cells. We can do it with human fetal stem cell or human embryonic stem cell in the Ukraine, and with the under license of Ukraine Health Ministry. Indication of ALC treatment with stem cell include confirmed ALC diagnosis, disease progression, and the lack of response to existing treatment methods prior to 2000. Contraindication of treatment included respiratory failure grade 3 and artificial lung ventilation, dysphagia, and presence of gastric stoma. However, nowadays, cell therapy in our clinic has experience of treating patients with the above-mentioned complication and disorders that allows the prolonging their life by more than 5 years. That is, please attention, more than 5 years. We can prolong, we can survive the patients with human fetal stem cell more than 5 years. After fetal stem cell therapy, 67% of ALC patients not diminishing weakness. Improvement of appetite, mood, decreases in intensity of fasciculations and spasticity like this. About 48% of patients needed to repeat the course of treatment during the year for raising the attention. Positive results in 25% case patients need periodic injection of stem cell every 1.5 to 2 years, my dear friend. Application of fetal stem cell does not combat the immediate cause of the disease. However, it exerts the substantial influence on links of the pathological process and slow down disease progression. That is very important. That is very important. Advise ALC and MND patients to get human fetal or human embryonic stem cells abroad. There is no treatment in Turkey. We cannot do it in Istanbul. We are bringing the patients to Kiev. That is officially approved treatment in Ukraine, in Kiev, under license of Ukraine Health Ministry. Other indication of human fetal stem cell is Alzheimer's disease. The treatment of Alzheimer's patients with fetal stem cells have to gradually restore many specific brain function. Positive results of therapy are observed. In all cases, application of fetal stem cell completely hinders for the levels of disease in 75% or at least substantially slows down progressive deterioration of brain functions. The most evident and stable effects of treatment, up to 19%, are achieved at initial stage of the disease when the first neurological and mental symptoms occur. Positive results are also observed in patients with organic brain lesion. Also in organic brain lesion, I don't talk so on this Alzheimer's disease. Please attention, Alzheimer's disease and cerebrovascular dementia and senile dementia are all 3 diseases. are indication of human fetal and human embryonic stem cells. Have you any question? Please write there. Please, you can write your question to comment part. I will answer then. Anemia, other indication of this human fetal stem cell treatment. Anemia is disease related to decrease in the total amount of red blood cells, erythrocytes, or hemoglobin in the blood that cause decline in the level of oxygen and carried from lungs to tissue. Anemia is the most common blood disorder, as you know, affecting about a third of the global population. We are treating anemia with human fetal and human embryonic stem cells. We have some medical case reports. I can show them. Stem cell therapy for patients with sickle cell anemia helps to reduce the frequency of crises, suit their course, as well as decrease the need for repeated transfusion of packaged red cells that are associated not only with the well-known risks, but also very stressful for the patient. Other indication of human fetal stem and human embryonic stem cell are arterial hypertension. It is a very big problem in Turkish population according to medical statistics. Arterial hypertension or elevated blood pressure is the main cause of death all over the world, along with cerebral atherosclerosis. Our clinic offers fetal stem cell therapy in combined treatment of arterial hypertension aimed at the improvement in the condition of arterial walls and the blood pressure stabilization. Prior to treatment, a continuous hypotensive therapy regimen is selected that allows for preventing hypertensive crises and diastolic pressure stabilizes at the level no higher than 90 millimeter pressure. Stem cell therapy allows to completely restore the integrity of the vascular tissues and their elasticity, conductivity, and strength at the biological levels. I will not talk so on. That is enough for arterial hypertension. That is the indication of human fetal and human embryonic stem cell. We will advise you get treatment of human fetal stem cell. They see a lot of clinical benefits with the human fetal stem cell, especially in arterial hypertension disease. Other indication is post-cancer treatment. Post-cancer immunologic treatment is a part of human fetal stem cell treatment. As you know, fetal stem cell treatment is not alternative to standard protocols of treating cancer. Stem therapy is possible only after surgery and or traditional chemo or radiotherapy in case they are indicated to the patient. Well, except for treatment patients with stabilized condition proved by the results of instrumental and laboratory findings, there should be no primary tumor growth or no metastasis, new metastasis formation. I will end this chat at here. We cannot treat cancer with human fetal stem cell. After conventional therapy, we can aim the patients immunologically with human fetal and human embryonic stem cell. Cerebral palsy. Cerebral palsy is the major indication of human fetal stem cell. As you know, we are doing in Kiev, Ukraine, under license of Ukraine Health Ministry. The main stem cell treatment results include in cerebral palsy replacement of lost brain cells and repair or protection damaged nerve cells. Fetal stem cell treatment has to limit the damage to cell the brain and makes the symptoms of cerebral palsy more manageable. Fetal stem cell treatment has to limit the damage to the brain and makes the symptoms of cerebral palsy more manageable. A combination of routine methods and the stem cell therapy leads to a number of improvements in the cerebral palsy patients. Not just reduction of hypertonic in extremities, not just reduction of hypertonicity in extremities, also improved balance, increased mental development, and such patients' interest in external external things, concentration, memory, and learning ability, normalized function of internal organs, and better social adaptation, and easier care for the child. Stem cell therapy is used directly to augment the regenerative abilities of an injured brain. It opens new opportunities in treating cerebral palsy, and the grafted stem cells are able to ameliorate severe injury-related neurological defects. Stem therapy is a very powerful driver, and the best results are reported in the combination with physical therapy and occupational therapy to improve movement and mobility, and the speech therapy to improve communication skills. Just enough for cerebral palsy. Other indication in human fetal stem cell therapy is developmental delay. Developmental delay is a failure for a child to meet certain developmental milestones such as sitting, walking, and talking at the average age. A developmental delay may indicate a problem. And in the development of the central nervous system, the child's mental development is delayed, leading to poor motor and communication skills, such children catch up and standard and development milestones later than normal children. Our clinic depend 25 years. 25 years, that's attention please. 25 years ago, and he has treated a large number of children from all over the world. Improvements were reported in most cases. For optimal effect, it is important to start stem cell treatment with your child as early as possible, while the brain is developing. Community treatment involving routine therapy and stem cell results in a number of improvements. Cognitive improvements, easier contact with the child and starting with the eye contact, and improved verbal capacity and better learning capacity, improved information processing such as memory, improved social adaptation, better self-care skills, boosted immunity. The advantages of these methods are lack of side effects and no chemical involved, and minimal invasive procedure, no rejection risk, no cancer risk, and a lifetime follow-up. That is enough for developmental delay. I will continue. Other indication is erectile dysfunction in human fetal stem cell. As you know, erectile dysfunction is an inability to maintain erection sufficient for coitus for 3 months and longer. It can be caused by both physiological and somatic, urologic, endocrine, vascular, and neurological disease, etc. factors. In 50% of cases, both factors are present. In 50% of cases, both factors are present. Fetal stem cell therapy results in physical, emotional, and generational health improvements, better sleep, hormonal balance, and improvement of arterial wall quality and vasomotor tonus, and immune system regulation, body regulation, potential stimulation, and the better tissue quality, which ensures optimal condition for sexual activity and libido improvements. In order to solve the problem the most effective way, collaboration of the patient and doctors is needed. Only sincere and straight talking about all the problems and will help to adjust our clinical protocol to meet the patient's need. Diagnostic include history, collection of and study, filling the forms, examination like this. It is enough. I talked about it. Erectile dysfunction. Other indication is Parkinson treatment. Parkinson disease. Parkinson disease, as you know, is a degenerative disorder that central nervous system characterized by different neurological disturbances related to the motor skills balance and physical, emotional disturbance, cognitive impairments, and social behavioral disorders. The symptoms of Parkinson's disease results from degeneration of dopaminergic neurons of the brain that produce to accumulate dopamine. Dopamine is a neurotransmitter, chemical serving to relay electric impulses from neurons. The cause of Parkinson's disease not have been defined. Common cause of Parkinson's disease include combination of several factors, in particular aging, some toxins and chemicals, and others. Other causes of Parkinson's disease include cerebral atherosclerosis and heat trauma and the tumor, virus, infections, etc. Parkinson treatment with stem cell, we'll talk about this topic. Our clinic, in our clinic, we offer Parkinson treatment with fetal stem cell. We have developed scheme of stem cell treatment for management and control of disease which have proven to be effectively in case of different forms and all stages of Parkinsonism. At stage 1, 2, and 3, when uni and bilateral manifestations. The diseases are observed such as balance disturbances, tremor, mild and moderate rigidity, and etc. Administration of fetal stem cells is effective in 85% of cases. Attention please. It's effective in 85% of cases. After the treatment, patients report improvement of stiffness, decrease in shaking while walking, and tremor. The dose of anti-Parkinson drugs can be lowered. At stage 4, stem cell treatment is effective 65 to 70% of Parkinson's disease case. At stage 5, our therapy helps to improve patient's quality of life and ease care for the patient due to decreased spasticity and tremor syndrome and improved sleep, normalization of organs and systems functioning. My dear follower, that is enough for Parkinson treatment. That is an indication of human fetal and human embryonic stem cell in Ukraine, and we are managing the treatment under license of Ukraine Health Ministry. Legally and ethically, we can do it in Kiev. If you have any advice or question, please write there. I will reply later. Other indication of human fetal and human embryonic stem cell is rheumatoid arthritis and other rheumatismal disease. Application of fetal stem cells allows for achieving conspicuous positive results in treatment of rheumatoid arthritis. Indication of fetal stem cell therapy in patients with rheumatoid arthritis are follow as I will ask no indication of rheumatoid arthritis treatment in human fetal stem cell. Rheumatoid arthritis resistant to standard treatment is an indication. Ineffective and anti-inflammatory drug therapy and including glucocorticoids and cytotoxics, that is an indication too. And marked decrease in functional capacity of joints, that is an indication. And the fourth indication is trophic disturbances of the musculoskeletal systems. And the fifth indication is considerable deviations of immunological and hematopathic parameters. That is 5 indication of human fetal stem cell in rheumatoid arthritis. I talked it. For treating patients with seropositive and seronegative rheumatoid arthritis of activity grades 1 to 3 with joint functional insufficiency of grades 1 to 3, fetal stem cells of mesodermal, ectodermal, and endodermal origin are used. As early as within the first day after therapy, the early post-treatment improvement syndrome is observed in all patients, and diminishing weakness increases motion activity and normalization of sleep and improved appetite, like this. Within 3 months after therapy, inflammatory processes activity decreases, morning stiffness, joint tenderness, and ODM diminishes, Rich's index decreases, patient's functional capacity improves, ASR decreases and returns at normal G-reactive protein levels, and rheumatoid factor titer declines, CD3 plus CD8 plus, and the natural killer lymphocyte count is restored. In most cases, 85% complete discontinuation and or considerable dose reduction of glucocorticoids and non-steroidal inflammatory drugs had been achieved. According to X-ray data, and no progression of joint damage is observed in 72% of patients, and in 80% patients it was possible to achieve remission along with better quality of life. Remission lasted from 6 months to 3 years. 6 months to 3 years. Yes. That's enough for rheumatoid arthritis and other rheumatismal disease. All of them are indication of human fetal and human embryonic stem cells. Other indication, my dear follower, my dear friend, spinal muscular atrophy. As you know, spinal muscular atrophy is a genetically heterogeneous group of hereditary neurological disease and one of types of motor neuron illness. Clinical symptoms of spinal muscular atrophy: 1. Flaccid paralysis and atrophy striated muscles. Other, fasciculations. The third one, symmetric lesion of proximal muscles. And fourth one, lesion of respiratory muscles, and that includes pronosis of the respiratory lineage. 5 months, spin deflection like this. We have positive experience of treatment of acute genetical disease affecting the spinal motor neurons. Treatment with stem cell allows for attaining in remission 75% of cases and for diminishing neurological dystrophy manifestation in spinal muscular atrophy patients in 19% of cases. Other indication is ulcerative colitis and Crohn's disease. That is, all of them are indication of the pluripotent stem cells, especially human fetal and embryonic. We are using fetal and embryonic stem cell in Ukraine and other abroad country. That is possible in almost 10 countries in the world. Worldwide, that is restricted treatment, and it's forbidden to use pluripotent stem cell in Turkey. That is, all of studying are in Ukraine under license of Ukraine Health Ministry. My dear follower, ulcerative colitis, Crohn's disease, as you know, there is comprehensive treatment. We need comprehensive treatment patient with non-specific ulcerative colitis and Crohn's disease. We use fetal stem cell suspension containing stem cells for this treatment. And administration of fetal stem cell is effective in case of both acute and chronic forms of non-specific inflammatory bowel disease of all severity grades, including severe course. Indication for use of fetal stem cell are as follows: progression disease unresponsive to the conservative therapy for 2 weeks, and presence of extra enteric complications, and impossibility to carry out surgical in one intervention due to patient's severe condition, exhaustion, and difficulty finding the same blood group for transfusion. That is the indication of using fetal stem cells in ulcerative colitis and Crohn's disease. The treatment patient with non-specific ulcerative colitis. I'll not continue this topic. I want to talk about ulcerative colitis, the treatment of ulcerative colitis with human fetal stem cell, ameliorate the symptoms. After cell treatment, the red blood cell count is restored and the hemoglobin level is normalized. In patients, application of fetal stem cell restores the immunocompetency and hinders the progression of an autoimmune process. That's enough for ulcerative colitis. We'll continue with other indication of human fetal and human embryonic stem cells. Other indication is infertility, male infertility. As you know, there are a big problem, male infertility, for man's health in the world, and there are a lot of patients in Turkey. They are asking us about human fetal stem cell therapies, possible or not. In our country, developed and successfully implanted a new method of improvement and restoration of fertility function in men using fetal stem cells. About 50% of our patients have solved their problem with male infertility. Clinic success is 50%. The usage of stem cell technologies in treatment of infertility in man influences in different causes of this problem, such as blood vessels and the hormonal metabolic problem or inflammation. Using this technology, we can achieve positive effects in those clinical cases which were not prospective in view of traditional option of therapy. Our results in restoration of male infertility consisting increasing amount of active sperms in ejaculate during 6 months after fetal stem cell therapy report in almost 50% of cases. Other indication of human fetal stem cell is knee treatment, osteoarthrosis treatment. Stem cell therapy is novel and effective approach to treatment of knee joints. It is based on the unique ability of stem cell to restore the cartilage and the structure of knee joint, and stem cells are the source of chondroblasts and chondrocytes and responsible for the formation of restoration of extracellular matrix of cartilage. Since fetal stem cells show full immune histocompatibility, such therapy helps to achieve quite fast improvement without any kind of immune suppression. There are 3 types of knee joints arthritis. I will talk it about stage 1 and stage 2 and stage 3. The main improvements caused by increased amount of chondrocytes and much intense formation of extracellular matrix can be seen over 3 to 3 months. The results can last for 1 to 2 years if each patient follows all recommendations from the treating doctor. My dear follower, today I summarized the indication of human fetal stem cell and human embryonic stem cell treatment. If you have any question, please write there. I will reply. Have you any question? Please write in English. We came to the end of our chat now. Later will continue with other indications of human fetal stem cell. I request you, please follow me. Please follow me. Good night. Good night, all of you. If you have any question, always you can write me. See you later.